Hi, my name is Tim Long. I'm the CEO and founder of New Life Medical Centers. And today you've come across us because you're probably doing research in regards to stem cells and because you're having some sort of pain that's gotten to the point where it's time to do something about it. That may be knee pain or shoulder pain, hip. It could be arthritis, autoimmune issues, chronic inflammation. But something's happened in your life where you've gotten to the point where it's time to do something about it. So what I want to do is I'm going to do for you what I wish somebody would have done for me. And it's just cut through all the clutter, all the overpromises, all the sales pitches, and just tell me the plain truth. Get down to the bottom line, what is really works and what's really effective. And what I'm going to do today is I'm going to do that for you. So we're not going to have you sign up for a webinar, and we're not going to have any salesperson call you doing a sales pitch. That's not going to happen here. But what I want to do is to educate you on what to expect in the marketplace and to explain why we use the products that we use versus the others. So there's 4 ways in the United States that you can collect stem cells. 3 of those ways are from your own body. The 4th way is from amniotic allograft products, and I'll explain all that in just a moment. The first 3 ways they collect it from your own body, one is through adipose tissue, which is your fat. The other is bone marrow or through your blood. Now, we can do all of those, but we choose not to. And the reason for that is the stem cells they collect from those 3 options, the biggest reason they're just not as effective. And the reason they're not as effective is because they're the same age as you are. And when you were younger, like a teenager for an example, if you got a cut, it was healed in literally a couple days, literally. Or if you went out and did a bunch of yard work and moved a bunch of weight, that you weren't sore the next day. It's like nothing ever happened. Well, that's because your stem cells and the cells in your body were young and vibrant and were doing their job properly. But as we age, as you know, we degenerate and our cells degenerate. And they're just not as effective as they were. Otherwise, you wouldn't be aging. So, now you get a cut and it takes, 3 weeks for it to heal. Or go out and do some yard work, move a couple of heavy bags around and you pull a muscle in your back, or you're sore for several days. That's the difference between young cells and older cells. Well, the cells that you collect from your own body are the same age as you are. And they're just not as effective as amniotic allograft products. And again, we're going to cover that in just a moment. So let's get started. Adipose. How do they collect it? They collect it from your body fat. Typically what they'll do is do a minor surgery. It is very minor, but it's still invasive, and it's still going to have a recovery time. But they will liposuction your body fat. They will then take it and spin it down, pull out the stem cells, and re-inject it into the problem area. Now, besides the fact that the stem cells are the same age as you are, and they're just not as effective as if it were when you're younger, there's no way to know how many stem cells they're actually getting. So when they pull out that body fat and spin it down, they cannot count the stem cells that are in it. So you have no idea how many you're actually getting. Another issue with it is your body stores toxins in its body fat. So when they pull out the adipose tissue or the body fat and spin it down, they're re-injecting those toxins back into your body. Another negative aspect of it is that when they're doing the liposuction, they're actually causing injury. And there's a good chance that when they re-inject those stem cells into your body, they're going to target that new injury and not target the old injury as much as it should. So all those factors lead to a result that's not as good as it could be or should be. So that's adipose tissue. Also, recovery time typically, depends on the person, is typically 3 to 7 days. Just depends on the patient. The next option is bone marrow. Bone marrow, they typically will go into the pelvis, which means they're going to drill into the pelvis, collect the bone marrow, and then spin that down, pull out the stem cells, and inject that back into your body. Now, again, the stem cells are the same age as you are. Another aspect is it's a little more invasive, obviously, and the recovery time is going to be a little bit longer. So typically, recovery time with that is typically closer to a week because it's just a little more invasive. And again, it depends on the individual. Some heal faster than others. Also, you don't have any clue how many stem cells you're actually injecting back into your body. So that's the main reasons that we don't use those options, because if they did work and were effective, it's worth the recovery time. It's worth how invasive, the little minor surgeries. But we don't use those because there's a product that's much more effective than that. The third option is through your blood. Now, we call it platelet-rich plasma, or PRP. Some clinics will call it stem cells, but it's not really stem cells. There are some stem cells in the blood, but when they're doing PRP, or platelet-rich plasma, it's usually the platelets that's doing most of the healing. And we do offer that here in the clinic, but we only use it in situations where it's very minor. For example, like aesthetics, for someone doing hair restoration, or wrinkles, or microneedling on the face, or trying to cover up a scar tissue of some sort, or if you're just beginning to have like tennis elbow or golfer's elbow, where it's just beginning, so in the very, very, very early stages, we will use platelet-rich plasma, or PRP. But for any type of major injury or a tear or regrowing cartilage, we're not going to use it. Now, all three of those options, the adipose, bone marrow, and the blood, can work, and they do work. But you typically, in order to get the result that you're looking for, you're going to need many more injections or treatments, and it's going to take longer to get that result, or the result is not as good as it could be. Let me talk about number 4, which is what we use in our clinic, and that's adipose allograft products. Now, what are those? Well, I'm sorry, not adipose, amniotic allograft products. What happens, this is how we collect them, or we don't collect them, how the lab collects them. First of all, we use the FDA certified lab. They're the only FDA certified lab to collect biologics in the United States. That's the lab we use. And what happens is you have a mother and a doctor who determine that they're going to have a C-section, and they schedule it well in advance. So once that's been determined, the doctor will ask the mother, do you want to donate your placental materials, which is the placenta, umbilical cord, the cord blood, and the amniotic fluid, to science, because they explain to them that they're making products to help people. Well, if the mother agrees to it, they then contact the lab, our certified lab. The lab would then come out, test the mother, test the baby, and then when the mother comes in for her scheduled C-section, they will be there, and after the birth, they will then collect those materials and then take them back to the lab and make about 60 different products total. They have products that are for burn victims, for organ transplant, for regrowing bone. There's different things that they use them for, but we're going to talk about the products, exosomes, the Wharton's jelly, that we use in the clinic on a daily basis. Because it's usually, the Wharton's jelly, for example, is for joint pain or soft tissue repair or regrowth, and the exosomes are used more for where it's a body-wide systematic issue like autoimmune, chronic inflammation, arthritis, other issues that are body-wide or system-wide. So why do we use those products? One, and the main reason, is because they're much more effective. The reason they're more effective is because the cells are only 4 to 8 days old. And another reason is because the lab has done over 100,000 patients and never had one issue. It doesn't mean you can't, but it's very safe. They've never had an issue using any amniotic allograft product. So they're much more effective is the main reason, because again, the stem cells are only 4 to 8 days old. So you're going to typically be much more effective at repairing growth, the cytokines, the exosomes that are in them, the growth factors. They're all there, primed, ready to help that baby grow. Well, it's the same thing when those are injected into your injury. They're there to help you grow and quickly and recover as fast as possible. And that's the main reason we use amniotic allograft products compared to using a patient's own stem cells. Also, the recovery time. Let's talk about that. The recovery time with the amniotic allograft products, there is no recovery time because it's not invasive, almost none at all. We actually pull out the product, draw it up into a needle. If you have any type of joint pain or soft tissue repair, or you're trying to regrow cartilage, it's all through an injection. So the injection literally takes 2 or 3 minutes max. So as soon as the injection is over, you go right back to work. So there's no downtime. It's not very invasive at all, and again, 0 downtime. If it used exosomes for some reason, maybe you have chronic inflammation, autoimmune, arthritis, we will do that through IV push. And that's simply just, getting an IV. They'll do it similar to a blood draw, except for pulling fluid into your body, and that takes about 10 minutes. As soon as it's done, you go right back to work. So there's no recovery time, and there's no downtime. And the cells are only 4 to 8 days old. So knowing all of that, why would a clinic or physician choose to use a patient's own stem cells versus using amniotic allograft products? And the real reason, and it's going to be clear as day to you, is profit. Because when you do adipose tissue or bone marrow, it's very invasive. And when it's very invasive and it's a lot more involved in collecting the material, you think it's probably worth more money to do that. And that's kind of a sales gimmick, because, well, it's much more invasive, it's painful, so it must be better. Well, that's not the truth. The truth is with anytime they're collecting the material from you, the stem cells from you, and re-injecting them, you're providing the material, the product. All they're providing is time and a few supplies. So it's much more profitable because they have no product, no money or cost in a product. The amniotic allograft product, obviously you have to go collect the cell material, take it back and process it, and sort it into the different products, actually count the number of stem cells. That's another thing. With amniotic allograft products, we know how many stem cells you're getting, whether it's 50, 100, or 150 million. With each batch or each unit, we know exactly what you're getting. So it all has to be sorted, cleaned, tested, and then presented. So the amniotic allograft products are pretty expensive. They're not cheap. But that's why doctors or clinics and physicians will choose to use a patient's stem cells versus the amniotic allograft products, because of the profit margin. Now, again, also when they do the adipose or they're doing the bone marrow, it's much more invasive, so it sounds like it's worth more money because it's much more painful. That just allows them to charge more for that same product. And there's no proof or science showing that they get more stem cells from adipose tissue versus bone marrow versus blood. So when it comes down to it, unfortunately, it's all about the money. And in our case, the way we look at it, we just look at it like it's an office visit. The stem cell products, amniotic allograft products are expensive, but we try to keep them as low as we can as far as price and cost. So what you're going to find out in the marketplace is they will charge anywhere from $4,000 up to $16,000 for one of those treatments, and we are typically less than the lowest amount. But it just depends on what you need. We're typically let's just talk about the cost. The insurance does not cover any of these stem cell injections or procedures or amniotic allograft products. So just like I said earlier, you're going to find cost out there for like PRP. You can get 3 PRP injections for $3,000 or more, all the way up to $16,000. Where with us, for an example, our PRP injection starts around $900, all the way up to $4,000, depending on what type of stem cells that you're needing, or the amniotic allograft products that you're looking for. So there's a big difference in the price compared, and you get a bunch of better product. So, but that depends on what you need and how much you need is going to determine the price. And like I said, insurance doesn't cover it. Insurance will sometimes cover the office visit and the x-rays, but it does not cover the injections. What can you use it for? We've done a lot of knees, bone on bone, cartilage regrowth, cartilage tears, tendonitis, just about everything, plantar fasciitis, lots of shoulders as well, but lots of knees, even bone, even on lower back, lots of elbows as well. But we've had very good success at using amniotic allograft products and even some PRP for minor issues, for joint pain, neuropathy, like I said, cartilage regrowth, soft tissue repair, arthritis, chronic inflammation, autoimmune diseases, even issues where we've had an epidemic that's pretty recent where people have a lot of breathing problems. It's helped tremendously with lung capacity. So there's a lot of different uses for stem cells or stem cell related products. We use them mostly for body-wide or systematic issues or soft tissue repair. But there's products out there for like I said, organ transplants, bone regrowth, burn victims, and things like that. Even for hair. So there's a lot of different uses for it. The results, every patient is different. No one patient is biochemically the same, so every patient is going to get a different result. But what I can tell you, and you've heard already, I'm sure you've seen all the testimonials, you've heard about the celebrities and the athletes who have gone all over the world getting stem cells with awesome results. You will get, well, I would say you, but in general, we see lots of patients who get lots of great results. But there's no guarantee. If someone guarantees you a result, they're snake oil salesmen. They can't do that, especially in healthcare, because there's just no way you can't guarantee it. But what we can tell you is there's a high level of success by using amniotic allograft products. Insurance, like I said earlier, insurance does not cover it yet. It may at some point in the future, but it could be next year, it could be several years down the road. We don't know. It's headed in that direction, but as of right now, the insurance does not cover any type of stem cell or amniotic allograft product. It only covers like visco products, which are very difficult to get covered, and you have to have arthritis only, and it's just very difficult. But insurance at this point doesn't cover it. It's all cash, and like I said, with us, it's anywhere from $900 up to a few thousand, depending on what you're needing and looking for. Whereas a lot of other clinics are charging for an inferior product, $4,000 up to $16,000. Also, if there's a situation where we cannot help you with, it's in the United States, we have relationships with a medical group in Colombia, in Costa Rica, that we can send you to. You'll be there for 1 week, and they can treat you with different products that are a little more effective that we cannot be treated inside the United States. But it's pretty rare that we need a patient to go down there. But if it's a situation where it's like MS or something like that, Parkinson's, or you've had certain types of strokes, we can help you and put you in contact and get you down to that group in Colombia and Costa Rica to help you. And if it's something you need, we'll give you more information on that. But the recovery time, like I said earlier, with our products, if you have like say for example, it's a knee, hip, shoulder, lower back, you have a soft tissue issue, plantar fasciitis, those are through injection. So it's no different than you've had injections before. It's not much different than that. It's 2 or 3 minutes, and you're right back to work. With exosomes, like I said earlier, it's just an IV push, and you're right back to work. If you were to get the adipose and the bone marrow, those are typically, you're talking 3 days to a week. So the recovery time with the products that we use, there is no recovery time. You get right back to work. Side effects, like I said earlier, with the amniotic allograft products that have been tested, the baby and the mother have been tested. They're tested in the lab. They've had over 100,000 injections and have never had an issue. Now, you can still have issues with like side infections, where maybe a provider didn't clean the area properly before she did an injection, but that's very low. I'm not saying something can't happen. There's always a possibility, but they've had 100,000 injections, never had an issue. As far as side effects, there's virtually no side effects. Like I said, there's no downtime. As long as the provider does their job and cleaning the area before they do the injection and do their the prep, you're going to be good to go. So hopefully that has answered some of your questions about the different products out there, why certain clinics use them and why we don't, and the products that we use, what we think we feel is the best. But if you have any questions, feel free to give us a call. We promise you're not going to talk to a sales guy. You're going to talk to either a nurse or nurse practitioner or a physician. They'll be glad to answer any questions you may have. We do our consultations for free, and then you come in, we sit down with you and figure out what you're needing. And if you decide to move forward, we explain all the cost that's involved. We explain all this again in detail. And if it's a situation where it's too much for you at this time, we offer financing. So we do all we can to help the patient get the result they're looking for. So if you have any questions, feel free to give us a call, contact us, and we'll do what we can to help you.